Welcome to the Infant Nutrition PowerPoint. This is the asynchronous portion. So infant nutrition, we've got, what are our objectives? Well, we're certainly going to look at our current recommendations for infant feeding. We're going to look at our strategies and how to support and promote and advocate for our families. And we're going to look at kind of the common maternal complications or issues we tend to have around infant feeding. So I'm going to ask you guys, what type of infant nutrition is out there? And I'm pretty sure you've all got the either breastfeeding or bottle feeding. But have you ever thought about what's actually in the bottle? Is it formula? Is it breast milk? Is it sheep milk? So you can have breast milk, but it can be fed through breastfeeding, or it can be fed through bottle, or we might have some type of a formula in the bottle rather than breast milk. So what are our current recommendations? Well, we do know, so last week or a few weeks ago we talked about population health indicators. We do know that breast milk is the optimal nutrition source for human beings, and that when we are fed breast milk and through breastfeeding and skin-to-skin contact, that we tend to optimize our growth and development for that specific infant. So it's considered the normal and unequaled method of feeding infants. Our role is to advocate and educate, but at the end of the day, we need to support our families in having the information they need to make the best informed decision that's right for them. And for some families, that isn't breastfeeding and it isn't breast milk, or maybe it's breast milk in a bottle. So we need to give them that information for informed consent so they can choose what's going to work best for them. But we do encourage breastfeeding as it is considered the normal and unequaled method of feeding infants. The other recommendation is for breastfeeding, for how long? Well, should be exclusive breast milk, so no other foods or liquids up to 6 months of age, with continued breastfeeding with complementary foods for up to 2 years of age and beyond. Little side note or fun fact is that we are genetically have the enzyme lactose till around 7 years of age. So we have the ability to digest lactose, which is the main ingredient in breast milk and most milk, up until around 7 years of age. And then after that, we actually are not supposed to have that enzyme. So from a biological perspective, we should have the ability to breastfeed to be digesting breast milk until about 7 years of age. I know there's lots of controversy on that. Most people think they're doing good if they can get to 2 years of age or beyond, but we do have some closet breastfeeders, or some women that do feed for many years and as their children are toddlers. So why should you breastfeed? Why breast milk? Well, definitely the reason why we breastfeed is there's certainly a lot of health benefits for it, and you can see them all here. Now, I'll be the first to say, and it says in that STORK module, or Breastfeeding Foundation module, is even though we have some incredibly large, good studies around the benefits of breast milk and breastfeeding, there is so many other factors that it's truly hard to say what was the definitive factor that made that health improvement. But it is generally, most people do truly believe, and the research does support, that there's a lot of benefits to breastfeeding. So what are the differences between breast milk and formula? So if you've ever wondered, there is a lot of differences. So when we look at it, and I think the main difference is there's really no way to replicate it. There's no way you can truly have a formula that is equal to breast milk. Not only for all the micronutrients, but there are so many living antibodies. It's a living fluid that changes and adjusts from day to day, and moment to moment and hour to hour. So there's no way to truly replicate it. They're not the same. there's definitely lots of differences. And the other thing too is recognize that formula is not considered a drug. It is considered a food. So when we look at the regulations that surround foods, they are significantly different than the regulations around drugs. So the type of testing and research that has to go in for a food is a lot more lenient than what we would do for drugs. So if all of a sudden everybody thinks coconut oil is the next big thing and they're buying it off the shelves like crazy, we might have a formula company that says, hey, let's put a little bit of coconut oil in our formula. And it's approved through the Food Administration because this isn't considered a drug, so it didn't have to go through rigorous testing. I mean, I do believe there's some benefits to coconut oil. Do I think it's the best for newborns? I don't know, but I guess we'll find out. So at the end of the day, we truly have to recognize that formula and bottle feeding is not equal to breast milk and breastfeeding. And we also have to recognize that breastfeeding is more than just nutrition. So importance for clinical practice. The more we have these conversations earlier, the more we have education and talk about breastfeeding as a cultural norm, right from early ages onward up to child rearing and childbearing ages, the more uptake we're going to have in this. So we certainly know that. So lots of support and education around this. There are a few true contraindications for breastfeeding. Certainly in our society with maternal HIV, and since we do have access to clean water and sterilization, and we do have access to formula, there's a slight chance of transmission with HIV through blood. And, even though you shouldn't be bleeding when you're breastfeeding, there's always that slight possibility if there's a crack in the nipple that we might have infect the newborn. Sometimes maternal illness, moms are separated, they end up, we've had a few cases on the floor where moms are hemorrhage or they just get HELLP syndrome or something medically goes on that they end up going up to ICU and they're really, really sick. So even though they want to breastfeed, it's just not possible. So, we look at how can we maintain or get mom's milk supply back once she's healthier, and how can we, what can we do with that newborn in between while we're waiting for mom to be well enough to have her newborn back. There's a few very rare instances where newborns truly cannot metabolize milk. So galactosemia is probably the most common, or maple syrup disease. And these we test for through that newborn metabolic screening. So you can see why it's very important to do a lot of these routine testings. And then sometimes our moms are on meds that are just not compatible to breast milk. So that goes to that informed decision making again. What medical conditions do they have? What are the medication choices? And then we have to think about that impact on pregnancy and the developing fetus, as well as transmission through the breast milk and how that may impact the newborn as well. So when we look at this picture, we've got to think about what's happening, what's going on here. So I don't want to make assumptions, but we're going to, in this picture, say that this is, life partners or partners, that they are bonding and engaging with a newborn, but thinking about what's all happening. And most of you are probably saying, when I say what's happening here, you're probably saying, well, there's a baby that's breastfeeding. If you can see that is actually a head with a white toque on it, kind of mostly covered with a blanket. But babe's at the breast, attached and feeding, I think. I can't see and do a feeding assessment, so I don't know if there's a suck and swallow going on, but looks like babe is breastfeeding at a glance. So you're thinking, okay, well, what's happening? Infant nutrition. Babe's getting food. But there's so much more going on here, and this is where we get into Niels Bergman's research on skin-to-skin contact and kangaroo mother care and lots of other skin-to-skin research that has happened now. So with growth and development, we know that when you're skin-to-skin and we're tactile, oxytocin is released, helps with milk letdown. We also know that it has relaxing, so oxytocin is also considered the love hormone. So it helps with relaxation. And that skin to skin also helps stimulate neurodevelopment. help stimulate that growth and development and brain development. And while baby is here, they're smelling, they're tasting, they're touching, they're feeling, they're hearing the sound of mom's heart rate and the, lung air going in and out of mom's lungs. They're feeling her warmth. They're smelling, they're tasting. And the stimulation of all these senses are wiring and firing the neurosystem. And this is what's optimizing that growth and development. So there's so much happening while we're breastfeeding, not just giving that breast milk. So we really encourage that skin to skin and actual breastfeeding. So if we feel that breastfeeding is something that we should advocate for, that it has positive health indications for our populations, which it does, we have to also understand why people quit breastfeeding to help them be successful and continue on with breastfeeding. And the majority of the time they're quitting because they feel they don't have enough milk. There's lots of other reasons here. You can see sometimes the babies just kind of go on a bit of a nursing strike, and if they don't know about that or understand why they might be doing that, moms might quit. Some moms pure and simply do not enjoy it, and that psychosocial or emotional piece is important to recognize. It may not be for them. Sometimes just the nipple pain is just excruciating, and they just can't get past it. So it just really depends. Each family, each dyad is different, so we have to work with that family to see what's working for them. And then if they're not enjoying it or there's something going on, we have to identify that so we can help support them. All right, so we also know the social economic determinants of health that are educated moms that are, in the 30s, have good support, been to school. They tend to do the exclusively breastfeed for 6 months and then continue breastfeeding. But if they are going to quit, the number one reasons is typically around perceived inefficient milk supply. Doesn't mean they have poor milk supply, but they think they do. So this is where a lot of education comes in around infant behaviors, how to maintain milk supply, and more importantly, how to reassure the family that babe is actually getting enough milk. So even though they're cranky, even though they're crying, even though they're fussy, even though they want to nurse all the time, that isn't always an indication that they're not getting enough to eat. It might just be normal newborn behaviors and growing pains and immature systems that are a little bit achy and they're just not comfortable. That's typical with the newborn, but it's easy to interpret it that they're not getting enough milk. So when we think about perceived inefficient milk supply, you got a fussy baby, they're not settling, they don't think they've got enough milk, so they grab a bottle, bit of formula in it, and they give it to the baby, and next thing you know, babe settles. Or maybe it just really, really hurts and they can't even stand the thought of putting that babe to the breast and the pain when they go onto the nipple. So they give them a bottle instead. And we can all understand this. I mean, it makes sense to me. And when you have a babe that looks like this, rather than a babe that's crying and fussing and won't sleep and won't settle, it's no wonder that they go to formula and they go to the bottle at times just because they're desperate. They want a break. And sometimes they just want time to themselves. I want to sleep. So if somebody else can take the baby and give it a feed, then I can just have a rest. And there's legitimacy in that as well. So it's that education and that reframing. What does the research tell us? Well, we know that moms that breastfeed and keep their babes within arm's reach of them. So we're not supporting bed sharing or co-sleeping, but we are saying cohabitation where that babe's within arm reach, the cot or the crib is right beside the bed. The sleep cycles sync. So moms and babes tend to be in light sleeps and deep sleeps at the same time. So, they wake up, babe starts to fuss in that light sleep, mom's kind of in that light sleep, so she wakes up a little bit easier and maybe she doesn't feel refreshed, but she actually, at least she's not coming out of that deep sleep and going like, whoa, where am I, right? And just exhausted and fatigued. And we also have research that says that moms that breastfeed, even though they don't always get as many hours of sleep as a non-breastfeeding mother, they actually report that they get more deeper sleep and better sleep, and they feel more rested because the hormones of breastfeeding allow a mom to get into deep sleep a lot quicker than a non-breastfeeding mother. And if, sometimes dads just want to be involved, or they want to take over or do a feed, but we have to think about how else can dads be involved and still support the families, and this is education as well. So I always say, moms can be responsible from the neck up, dads can be responsible from the neck down. And it's not a bad skill to learn from the early stages that you don't always need food in order to be comforted and soothed. You can, maybe dad can play and interact or distract, or provide love in other ways that's not just through food. So going back to that whole low milk supply issue, why do people interpret they've got a low milk supply? Well, it's often because of the feeding patterns, and the babes are fussy and cranky, and they're like, I just fed you. How can you just be hungry again? I must not have enough milk. And the reality is that, we often have this myth. It's like, well, babies should only eat every 4 hours. And I am going to ask you guys, as you've been sitting here, and maybe, well, it's 15 minutes, but maybe you've been sitting at the desk for an hour. Have you put anything to your mouth? Have you had a sip of water? Have you had a bite to eat? And I would actually task you to do a feeding record for yourself and see how many times you take a sip or have a drink or have a snack throughout the day. And I almost guarantee you that you drink or eat way more often than every 4 hours. And a babe who has got to double their weight in the first year of life, or for 6 months, and triple it by a year, I guarantee you they are eating a lot more often than we are. We know in the reality, humans, we actually eat about every 35 minutes. And if the babe's at the breast and feeding for a long period of time, I think, well, I must not have enough milk. There must be something wrong. And the reality is some of us are grazers, and some of us can scarf our food back in about 5 minutes. You just don't know. Everybody's different. Boy babies tend to eat a little bit more than girl babies. Bigger babies often are eating a little more than smaller babies. But that changes up and things change. At the end of the day, it's normal for a babe to want to feed frequently. And there's some feeds where they tend to want to just chill and hang out and graze, and then come back for seconds, and then come back for desserts, and then maybe come back for a snack before they actually have a sleep. So that's normal. The other thing we know is that breast milk digests extremely quickly, but formula does not. So when you get that babe that's like milk drunk, and you see, like all of a sudden you give it a bottle of formula, and they've been crying and fussing and wanting to keep nursing, and then all of a sudden you give them formula and they're knocked out cold and they're asleep and stuff, and they stay sleeping a little longer, it's because formula sits in the stomach for a lot longer than breast milk. So they do tend to sleep a little bit longer. So some people might say, okay, when works for me. But at the end of the day, it takes away from growth and development. And the reason why breast milk digests so quickly is because it's brain food. It's feeding the system. It's feeding the growth and development. It needs to have that rapid absorption and metabolism in order to get to all the systems and to cross into the blood-brain barrier and to feed that brain and that brain growth. So that easy digestion is to maximize growth and development. And we also know that breast milk is on a supply and demand schedule. So the hormones of breastfeeding, after the first few days of milk supply is driven pretty much just by hormones. But after that, it's pure and simply supply and demand. When you have milk removal, when the babe nurses at the breast, or mom hand expresses or pumps, when there is breast stimulation and milk removal, it sends signals to the brain that we need to make more milk. So hypothetically, a mom can feed singles, twins, triplets, quadruplets. We had wet nurses back in the day. So a wet nurse is somebody that had a baby and was breastfeeding, but then continued to make milk or be wet and could feed other people's babies, and they just kept producing milk because they kept doing milk removal. So if a babe gets milk from a different source and is satisfied, and there's no milk removal, your body will automatically start making less milk. So if you want to increase supply, you have to increase demand, and you have to increase milk removal through baby nursing, hand expression, or pumping that milk out. So anytime you give a top-up or gets milk from somewhere else or gets settled or soothed when they're hungry with a pacifier rather than going to the breast, it can impact our supply. So we need to encourage them and let them know that it's okay that they feed frequently. If you're tired of having the babe tied to your breast and you feel like you're locked to the chair, let's talk about a wrapper or sling. How can you nurse and feed your baby hands-free while you're up and moving around and doing stuff? Or, how can you set up the home so when you're feeding that becomes a really enjoyable time and me time, where you read a book or watch TV or, listen to music or do something that you enjoy. And anytime babe gets milk from somewhere else, it not only can impact mom's milk supply, but it can, especially in the first few days when babes are incredibly impressionable to milk flow and nipple type, it can create nipple confusion. So if moms want to be very successful with breastfeeding, we do not want to introduce a bottle or artificial nipples or pacifiers. So those hard, easy to find nipples that they don't have to work at and can make babes a little lazy almost, and that's kind of what nipple confusion is. Babes like that easy to find hard nipple that they can latch onto quickly, that they don't have to work at to get any kind of milk flowing. And if they get hooked to that, it sometimes can be really, really, really hard to get them back to the breast, where they have to find the nipple, they have to work a little harder at it, and they actually have to kind of suck and stimulate at the breast to get milk. There's reasons why we supplement from a healthcare worker perspective. There's lots of legitimate reasons. We don't want to go there, and under breastfeeding friendly initiatives, formula has to be under lock and key, and there has to be a medical reason and an order to give supplementation. We're not there yet here at our hospital, but at a baby-friendly hospital, it would have to be under lock and key. But the reason why we give supplementation, the most common, is it's usually that we are having trouble with hypoglycemia. So babe's blood sugars are not coming up. Now there's some pretty good research that says formula, even though it can bring the blood sugar up right away, has a bit of a rebound effect and doesn't maintain sugars as well as breast milk. So if we can get them breastfeeding and get that supplementation through express breast milk, that's always the better way. But if that's totally unsuccessful, then we might have to use formula. There could be other medical reasons, right? Poor intake. Maybe there is true poor milk supply because of mom's condition or meds that's mom's taken, or she's, hemorrhaged and newborn jaundice. The babies are just not waking up and not eating. There are reasons why we will give supplementation, but it should be done for medical reasons. It should be absolutely necessary, and formula should be our last choice. And I would say not giving it in a bottle. We can spoon feed it, we can finger feed it, we can give it in a way that doesn't cause that nipple confusion. All right. So in maternal indications, maybe she's got a retained placenta, and that does impact our lactogenesis too. So it could delay lactogenesis too. Or they might have Sheehan's syndrome from postpartum hemorrhage, or they may truly have something going on with glandular insufficiency and hormones. And often these women will present that they don't have a lot of breast changes in pregnancy. So when I'm working with a breastfeeding woman at pregnancy, and we're talking about breastfeeding, I do like to know about if they've been noticing breast changes. So they usually typically go up at least, kind of a size, a bra size through pregnancy, and they notice changes with their breasts. They get fuller, they get larger. And if they're not noticing those changes, then that should be a little bit of an indication or warning sign too that there may be glandular insufficiency or hormone problems, or maybe they've had some kind of breast surgery. So I'm always aware when they've had a breast surgery, especially if it's a reduction. It could impact milk supply. And when we talk about breastfeeding and we talk about, there's all this hype about you got to breastfeed, it's best for your baby, you got to do this, you got to breastfeed. We got to be really cautious about having a guilt trip on our moms. At the end of the day, we need to support them and recognize that whatever they decide for them, that's okay. And you support that decision. What I want to know is that it's an informed decision and that they made that decision when they had all the information. And that, we don't want to put this kind of heavy burden of guilt on our moms for not breastfeeding. It is a choice at the end of the day, and we do have viable alternatives, and I'm very thankful that we have access to formula and bottles when we need it. So, we do need to support our families and advocate for whatever decision they make. We do know that failed breastfeeding can have impact on our moms as far as for postpartum depression. So again, however you read the research, you may interpret this as breastfeeding is protective against postpartum depression, or failed breastfeeding may cause postpartum depression. But we do know that about 11% of our moms report that it was failed breastfeeding that kind of tip them over into a postpartum depression. So at the end of the day, we need to empower our families with accurate information so they can make an informed decision around breastfeeding. So I'm going to pause here, or I'm going to stop here, and if you guys want to then go to that Baby Friendly Initiative video, and it's going to outline the 10 steps of becoming a Baby Friendly Initiative site, and then we'll come back and continue on.